Okay, I'm going to be doing the video on trach suctioning and also cleaning. So the first thing I'm going to do is check the doctor's orders, make sure that he did right for trach care. And then I would go into the patient's room, hand hygiene, and I would, verify name, date of birth, it's correct, provide patient privacy, and explain to the patient that I'm going to be suctioning out his trach. So then, this is my oxygen, just to let you know. Alright, so at first I would just put a chalk on the patient just to protect his clothing and make him feel better about getting suctioned. Okay, so first I'm going to have my sterile water here and my suction catheter kit. Okay, so I'm going to open it away from me. Okay, first thing I'm going to grab is the box. Okay, I'm going to put that right here. I'm going to put my saline in here. Okay. Next thing I'm going to do is get my gloves out. These are a little hard after you wear them multiple times. But once my one glove is on sterile, I'm able to touch the outside of the glove. Okay, so now I am sterile. I'm going to grab the suction tube out. So I'm going to want to place this in my right hand, the sterile end. So I'm going to be suctioning with this end, and with my dirty hand, my left hand, I'm going to be hooking it up to the suction, okay? So this is actually NG tube that I have for my suction. Sorry. Come on. And making sure that my client's O2 stat stays good throughout the whole procedure. Okay, so I'm going to dip the suction catheter inside to the saline, make sure that the suction is working. So now I am going to remove the oxygen and suction the trach, and never have it on suction as you go into the trach. To where you know you're in the right spot as soon as you hear the patient cough. And then you're also going to look at the patient, the orders, if the doctor wants continuous suction or intermediate on the way out. So if it's intermediate, you go into where the patient would cough, you would hit the suction, not continuously, and come out as twisting the tube. If they do want continuous, you would go in to where the patient would cough, same thing, and then continuous suction on the way out, also twisting the suction catheter on your way out. Okay, so you would just make sure that the tube is clear, dip it in the saline, and then go back in and hitting the suction on the way out. Okay. Never suctioning on your way in, only on your way out. Okay. Okay, so that is it for the suctioning. Making sure the oxygen is always on and the pulse ox is good. So now we're going to go into doing the cleaning of the inner cannula and the trach care around. So I'm going to put this away. Hand hygiene. And now explain to the patient that I'm going to be taking out the inner cannula, cleaning it up, and cleaning around the trach. Okay, making sure his pulse ox is okay the whole time, okay? So now I'm going to grab my care kit. I have my saline, and I'm going to open this away from me. gloves are on top and my hands are really sweaty, so we'll see. Putting my sterile gloves on. Like I said before, my gloves are on, so I'm able to touch the outside of the gloves. Okay, next I have my sterile drape. I'm going to be laying this down as my workspace and shiny side down. Okay, so now I'm going to take out the contents of my kit. Okay, so I have some gauze, I have a fenestrated gauze, and I have the scrub brush. Okay, so with this also you're going to have one dirty hand and one clean hand. So my left hand will be the dirty hand that's going to remove the oxygen off, and you could also touch the inner cannula on the very outside of the tip as we remove it. So I'm going to be removing the oxygen, removing the cannula, and then putting it into the basin that I already put my saline water in. I filled all 3 basins with my saline water. Okay, make sure that the patient has oxygen at all times. So now with my clean hand, I'm going to be taking the scrub brush and cleaning the inner cannula. Okay. And then dipping it into the other basin, cleaning it off, tapping it off, and placing it back into the patient. Okay, now I'm not sterile anymore because I touched it and I cleaned it off. So now I'm going to remove the old fenestrated gauze around from the patient. Get rid of that. Take my 4x4s, and in the one spot I did not use with cleaning the cannula, I'm going to dip my 4x4s in, cleaning them all around. Make sure to get all the gunk out. Also making sure that the trach collar doesn't have any gunk either. And I'm just going to clean this until it looks good and feels good for the patient. Okay, now I have the Q-tips. I'm going to go as close as I can and make sure that's all clean also. And I'm gonna take one side of the ties off because we're gonna change them because they look gunky too. If he had okay, so now I'm going to dry around the trach. Make sure everything is nice and dry. I'm going to add the fenestrated gauze and make sure that its V is up. Like that. Always checking his pulse ox and always reapplying the oxygen. Then I would change the one side. Bring it around, if it reached around his big neck, and then apply the other side. Okay? And of course, all during this, I would ask how my patient was handling it. notice any signs of distress and act upon that. Okay. All right. So, and then I would tell the patient that I would be coming back to check on him in a little bit, and make sure he's comfortable. Thank you.